Today we're going to discuss communicable diseases, in specific the intestinal infections, which are caused by various bacteria, viruses, parasites, which affect the human gastrointestinal tract. What are the symptoms that we get once we get an intestinal infection? These are nausea, abdominal pain, vomiting, and diarrhea. There are acute diarrheal illnesses, there are poliomyelitis, cholera, typhoid, food poisoning, viral hepatitis, amoebiasis, ascariasis, hookworm infection, rancuniculiasis. So, cholera. The epidemiology is it affects at least 47 countries and an estimated 2.9 million cases per year, and out of which 95,000 people die. Cholera is stark marker of inequality, indicator of lack of social development. Climate change, urbanization, population growth are likely going to increase the risk of cholera in the coming years. The epidemiological triad, which is very important for every disease which can come in OSPI, the agent is Vibrio cholera. It is killed by boiling. It is killed by cresol, bleaching powder, drying in sunshine. And the host is the man. Stomach acidity is an effective barrier. If your stomach is acidic, it can kill the bacteria. The poor economic status, poor hygiene, and extremes of age can predispose you to developing this infection. The environment, poverty, lack of education, poor housing, lack of awareness. The incubation period is few hours to 5 days. Period of communicability is 7 to 10 days. So, what are the stages of developing a cholera infection? There is a stage of evacuation which has an abrupt onset. There is profuse watery diarrhea. And the watery diarrhea is like rice water stool. It is followed by vomiting. First diarrhea, then vomiting. This is the stage of evacuation, then comes the stage of collapse. There is rapid dehydration after so much of the fluid loss through diarrhea. There is sunken eyes, washerman hands and feet, and scaphoid abdomen, muscular cramps, and suppression of urine. And death may occur in the stage of collapse. Then there is a stage of recovery, which, slowly the person gets better. The chain of infection is like the source, which is the man, can be cases or carriers. The mode of transmission is fecal-oral, and then the susceptible host is another man. Reservoir carriers, incubatory, convalescent, healthy, chronic carriers. Incubatory carriers are potential patients. Convalescent carriers are people with recovery phase. Contact healthy carriers can spread in less than 10 days, and chronic carriers can shed that infection from months to 10 years. Oh my god. The mode of transmission is fecally contaminated water, contaminated food and drinks, contact with contaminated hands. Uncontrolled water resources, bottle feeding, fruits and vegetables not washed properly, cooked food may be contaminated with hands and flies. The host factors are age and sex. Gastric acidity protects you from developing Vibrio. Population mobility, economic status, poor economic status, and poor immunity. Diagnosis is the collection of stools, and we do culture, vomiters, food, water. All of these samples can be collected. Transportation, uh, which is like direct examination under microscope. The culture methods are PWT and BSA medium. Why it is important to control? Because if rapid replacement of fluid and electrolytes are not done, the case fatality is as high as 30 to 40%. Means if you're not going to, you know, resuscitate the patient and replenish his fluid, there are 30 to 40 30 to 40 people out of 100 that can develop mortality. So it's very important. Uh, if a patient who's aged 5 or more, he develops severe dehydration and acute watery diarrhea, and if there is a place in which there is a cholera epidemic, and a case of cholera has been confirmed, or Vibrio cholera 01 or 0139 is isolated from any patient with cholera. How do we control an epidemic? Verification of diagnosis, notification, case finding, establishment of cholera treatment centers, rehydration therapy, ORS solution, adjunct therapy, antibiotics, epidemiological investigations, verification of diagnosis, notification, case finding, establishment of cholera treatment centers, rehydration therapy, adjunct therapy, epidemiological investigation, sanitation methods, chemoprophylaxis, vaccination, and health education. There are two types of vaccines available: monovalent and bivalent. Monovalent is Dukoral and bivalent is Sancol or Morvax. So there is skilled vaccine, two doses 7 days apart, or two doses 10 to 14 days apart respectively. So yeah, early detection, multi-sectoral approach should be there, and effective coordination. So period of quarantine is 2 to 12 days was its incubation period, no? Period of communicability is 1 to 7 days, and incubation is 5 few hours to 5 days. So you can give quarantine for 5 days, no? Food poisoning. There is history of indigestion of common foods, and it can attack many people at the same time, which is important. You can get a case in which a lot of people are experiencing food poisoning because they ate from a common source, a common restaurant, a common food, contaminated food. So many people can be affected, and there are similarities of signs and symptoms. The agent can be staph, salmonella typhi, staphylococcus, clostridium botulinum, clostridium perfringens, bacillus cereus. The non-bacterial or chemical toxins: host is the man, age, economic status, poor hygiene, environment, poverty, lack of education, poor housing, lack of awareness. Kind of the same epidemiological triad that we use for cholera. So yeah, salmonella has 12 to 24 hours of incubation period. Dairy products, fever, nausea, vomiting, profuse watery diarrhea are its signs and symptoms. Staph aureus has salads, custards, milk products, diarrhea, abdominal cramps are its important major signs and symptoms. Clostridium botulinum, home preserved canned food. Dysphagia, diplopia, toxicity, dysarthria, bloodstain, of vision, muscle weakness, quadriplegia. Clostridium perfringens, diarrhea, crampy abdominal pain, and contaminated meat, dishes, poultry can cause it. Bacillus cereus, salads, custard milk, and Campylobacter unpasteurized milk, whose foul smelling diarrhea. The DDS, cholera, bacillus dysentery, arsenic poisoning. How do we control it and prevent it? Food sanitation, meat inspection, personal hygiene, food handling techniques, sanitary improvements, health and education of food handlers, and refrigeration. Cooking it at the same day. 10 to 49 degrees Celsius is danger zone. Less than 4 degrees Celsius is appropriate. Surveillance is important. Keep clean, keep separate raw and cooked food, cook food thoroughly, keep food at a safe temperature, use safe water and raw material. And how do we investigate? List of people involved, the history, lab investigation, environmental study and inspection, data analysis, formulation of hypothesis, and conclusion recommendation.